Okay, so I'm going to demonstrate the IV site assessment, and I'm also going to demonstrate how to prime a primary and secondary IV line. So first, I'm going to check my orders. I'm clearly dealing with an IV. I'm going to gather my supplies, so I'm going to make sure I have my primary bag, my secondary bag. I'm going to have my primary line, my secondary line, pair of gloves since we're always messing with an IV. I'm going to have an alcoholic swab. Since I don't have a medical stand, I'm going to go ahead and use these hangers in the back of my door. So I'm going to wash my hands, and then I'm going to put these gloves on. Okay, once I get these on, I am going to gather all of my supplies and head into the room. Okay. Jeez, sorry. Alrighty, so I'm gonna get all my supplies, gather them all up, and then. Hi, my name's Thomas. I'll be your nurse today. So it looks like we're dealing with some IVs. I have a couple IVs we're gonna get, IV fluids we're gonna get primed for you and get going. The primary is typically for hydration, and the secondary is typically for some sort of medication. First, I'm gonna come in. I'm gonna assess the IV site. I'm gonna make sure that it is clear, it's dry, it's intact. I wanna make sure there's no redness, no irritation, or any swelling. Once I go ahead and do that, I'm gonna get ready to prime my IVs. So first, I'm gonna take my primary bag right here and my primary line. Once I get this out, I'm immediately going to clamp the line. So I'm gonna roll this all the way down. I'm gonna take this apart here. I'm gonna take this end, pull this off, this spike, and I'm also gonna take this primary and pull this red end off of here. I'm gonna push this all the way in. And twist to the filter. Go ahead and turn this upside down. I'm gonna squeeze this halfway full. About right there. And then I'm going to unclamp this line, holding this up here, and have this go all the way through this. Making sure that there's no bubbles or anything like that. Clamp that back down. Set this up here. Probably should have hung this on the line first, but since I'm at home, it's easier for me to do it here. So I'm gonna go ahead, get this hung up here. Go ahead and set this here. And then for the secondary, I'm gonna do the exact same thing. So I'm gonna pull the secondary out. And for the secondary, since it's a medication, we want it to go a little bit faster. So I'm gonna make sure I apply this so that the primary is hanging lower than the secondary. So I'm gonna go ahead and take this one off of here. And apply this to the here. Quite get it. There's that. I'm gonna put this on here. So the primary is hanging lower than the secondary. For the secondary, I'm gonna go ahead and get this unstrapped, and as soon as I take it out, I immediately want to roll down and clamp this. So I'm gonna go ahead and roll this down, clamp the line. I'm gonna take this off here, take this off here. I'm going to pierce this down so that the filter is all the way through. Twist that, turn this upside down, fill it about halfway, squeeze that to about right there. I'm going to unclamp this, prime it all the way way to the end. Make sure it gets all the way to the end with no bubbles. Okay, right here. Then I'm going to attach this here, making sure that the secondary hangs higher than the primary, so that with help of the gravity, it's going to circulate into the system quicker. So then here, I'm going to make sure that when attaching the secondary to the primary, I'm going to do the port closest to the primary bag. I'm going to make sure I get this IV or this sterile wipeout and clean the hub right here where it attaches. I'm going to attach the secondary to the primary, just like this. Twist it on, make sure it's all the way on. And then we primary. I would attach this to the pump, and then once everything's done, I have to make sure my secondary line's primed, the primary line is primed, and then I'll get this started. I also make sure to assess the site again, make sure there's no irritation, there's no leakage, there's no edema, there's no irritation or redness. I want to make sure there's no coolness above the site, and then I'll closely monitor. I will clean up all my supplies. I'll check in with the monitor every once in a while just to make sure fluids are running properly and rates haven't changed. And then I'll gather my supplies, I'll clean up, I'll wash my hands, and I'll document.